to Women's Health Tips and Q&A. I'm Dr. Nina Graham. If you were brought up in a typical Bahamian family household like I was, life was based on 3 R's: reading, writing, and arithmetic. Discussing sex was a no-no. So women were often educated about sex from an older sibling, cousins, a friend, or simply by experimenting. Not much has changed over the years, and females are experiencing sex at an even younger age, with no idea of the ramifications of sex on their bodies, especially in the areas like the cervix. During my gynecologic history, I would always question women on the last time they had a pap smear. Far too often, the answer is disappointing. Women hardly take the time out to care for themselves, as they are just too busy working, going to the grocery store, picking up the kids to and from school or extracurricular activities, paying bills, and, well, of course, saving the world. There are very few events that make women see their gynecologists: pregnancy, abnormal bleeding, recurrent discharge, an itch, an odor. So if none of these things are occurring, why go to an appointment with a gynecologist? I am just too busy. The cervix is the neck of the womb, that part of the genital tract that dilates during childbirth. Cervical cancer occurs now when the full thickness of the cervix is involved with abnormal cells. And these cells invade the bloodstream and other parts of the body. The good news is that cervical cancer is preventable. You hear these, ladies? You hear it? It is preventable with regular screening, of course, vaccines, and other procedures. In the United States, there has been a 50% reduction in cervix cancer cases with the advent of the pap smear. There has not been, though, such a decrease seen in the Bahamas. As a matter of fact, since the 1990s, cervical cancer cases and death from cervical cancer cases have increased by almost 5%. Cervical cancer is the second leading cause of cancer deaths in Bahamian women after breast. And in the region, 72,000 women are diagnosed and 33,000 die due to cervical cancer. Why do you think this is? I think it is probably be due to a lack of screening. As the saying goes, prevention is better than cure. So if there is one resolution you need to make and keep, let it be to get screened and be vaccinated against the human papillomavirus, or HPV, which is the cause of abnormal cervical cells and cervix cancer. If you do not check on the health of your cervix at any time, let it be this year. Make an effort for it to be this month, because January is Cervical Health Awareness Month. As women, we have the power to create. Let's not give it away.